Welcome to the Health Channel, All Health All the Time. I'm Olga Villaverde, coming to you from the Baptist Health South Florida studios. We've all heard of varicose veins, but how much do you know about deep vein thrombosis, or DVT, or even superficial thrombosis? All of these can be characterized as venous diseases. So here to talk more about this is Dr. Chaminda Jayanetti. He is a vascular surgeon at Miami Cardiac and Vascular Institute, as well as at Miami Vascular Surgery. Welcome, doctor.
Thank you for having me on the
show.
show.
Thanks for being here. Being a vascular surgeon, you know, I think of my father. That's what his specialty was.
Right.
But I'd like you to share with our viewers what a vascular surgeon is and does.
Sure. Vascular surgeon is a surgical subspecialty that basically treats all conditions of arteries, veins, and lymphatics. We're unique in our specialty in that we offer all kinds of treatments. Many of our patients are treated just with medical therapy alone or with other simple treatments that are non-surgical. We also offer a full spectrum of minimally invasive treatment, such as angioplasty and stenting of blood vessels. And we also do major surgical vascular reconstructions when necessary or needed. We treat conditions in almost every part of the body, really with the exceptions of the heart and inside the brain. And some common conditions that we treat are blockages in carotid arteries, which supply blood to the brain, aneurysms of the aorta in both the chest and abdomen, as well as blockages of arteries in the legs and elsewhere in the body. And another large part of our practice also involves treatment of venous disease. Varicose veins, deep vein thrombosis are some of the entities included in that.
And you just talked about the one that we're going to be focusing on today, and today we're talking about those venous diseases.
Right.
I actually have a statistic here from the National Institutes of Health, and they say varicose veins affect about 15% of the population. So how common are these diseases?
They're actually very common.
Very common.
Up to 3 million new cases of varicose veins are diagnosed every year, and the characterization in every age group after the age of 19 characterizes it as being very common. So all the way from late teenage years to patients in their 90s and above can have varicose veins and venous disease. So it is very common.
So let's do a little bit of Anatomy 101 today on the Health Channel, and let's talk about the veins, arteries, and the heart and their functions. I remember the arteries you learned at school, the A was for away.
Right.
Blood away.
That's correct.
There you go. 20 years later, I still remember. 20, I'm just kidding, 40. So break those down for us.
Yeah, basically blood starts its trip around the body at the heart, which is a muscular pump. The blood then goes through a large artery called the aorta into the arteries, where it's distributed throughout the body and travels eventually into a vessel called capillaries. Capillaries are sort of the bridge between the arteries and the veins. A lot of important functions occur in capillaries. Basically, oxygen goes out of blood and into tissues, nutrients goes out of the blood and into tissues, and waste products come in to the capillaries and then get carried back through the veins, which go from microscopic to larger and larger veins, and eventually to two very large veins called the superior and inferior vena cava, and then back to the heart to start the journey through the lungs to get oxygen and back out to the arteries.
It's really amazing to watch that whole thing happen as well. And it happens in split seconds. It's fascinating. So now, doctor, if you could explain the difference between superficial veins and deep veins.
Sure.
What are the difference of those two?
Superficial veins are veins that are basically located in the fatty layer just beneath the skin. Deep veins tend to run deeper in the body, of course, as their name implies, near and through muscles, in the deep cavities of the body. They're often accompanied by an adjacent artery. And those are some of the basic differences between a deep and superficial vein.
And what effect does venous diseases have on our veins?
Basically, venous disease, in its most common form, which is varicose veins, tends to make veins larger and function less effectively in that role of returning blood back to the heart.
And then the venous diseases then have an effect on our overall health as well, right?
Yeah, they can. Venous disease can have an enormous impact on a patient's lifestyle. It can make them feel less or want to be less active, more tired, less energetic.
Exactly.
It can cause a lot of problems in the skin, for example, in the legs. And it can also cause some more severe problems such as deep vein thrombosis and its effects.
All right, I want to start off by talking about varicose veins. So, doctor, if you can go to our 3D image wall,
Sure.
I'd like to show our viewers exactly what's happening because they're very common. They don't pose a health risk, I do know that, but they're very unsightly to see, let's be honest.
Yeah, they can be. But thankfully, yeah, you're absolutely correct in that varicose veins don't typically pose a health risk. They can certainly cause symptoms, though, and that's a big misconception amongst the patient population. A lot of people put off maybe coming to see a physician related to varicose veins, mainly because they feel that the problem is merely cosmetic, and they don't want to take up anyone's time. But it can really be the opposite. Varicose veins is a real disease process. As you can see on this diagram, what happens with varicose veins often starts with a structure called the valve of the vein. These are basically two leaves that open and close inside the vein, much like a one-way swing door. So blood can generally only go upward back towards the heart through this valve, and then when a patient stands or is in a position that doesn't promote that upward flow of blood, these valves are designed to close right back up and not let any blood flow back downward to where it originated from. Valves can become dysfunctional for many reasons. One can be essentially wear and tear that can happen with either aging or very intense activities. Valves can also become dysfunctional from trauma that may directly affect the valve, and other factors such as obesity, hormonal effects. When these valves become dysfunctional, they don't close completely, and blood is then allowed to go back downward in the vein, usually with gravity. When that happens, as you can see with this part of the vein here, which is, we'll call it a normal size, the part that's below the dysfunctional valve becomes very large. The walls not only grow, the walls grow in length as well, which takes a vein from being nice and straight and makes it have all these curves in it. And basically we end up with what's a varicose vein. Varicose veins, when they get this stretched out, can lead to numerous problems, one of which is that blood inside the vein can actually start seeping outward into the skin. That's very inflammatory for the skin. The skin sometimes develops a dark discoloration. It can become inflamed, reddened, create a rash-like appearance. Veins that also get this large are more susceptible to clotting because the blood is not flowing nicely through the vein. The blood is staying still, and as we'll probably get to later, that's one of the factors that can lead to clotting of blood. So varicose veins also at this stage can start to cause pain, which is a big thing that brings people into our practice. People feel burning pain in the veins themselves. They can feel heaviness and tiredness of the legs, as these veins also now don't function as well to take the nutrients or the waste products of metabolism, or the waste products that occur in muscles, out of the muscles and back to the heart to get eventually metabolized elsewhere in the body. These metabolites, or these waste products of just normal cellular function, can sit around in the muscles and the cells and create cramping of the muscles and other pain. So a lot of effects can occur with varicose veins.
And doctor, we're showing a picture of someone's leg. It's
Right.
very common in the legs. Why is that? And why are women more likely to get varicose veins than men?
Yep. Leg veins are affected very commonly, mainly because legs are the lowest part of our body. They're the most subject to the effects of gravity. They tend to develop that valvular dysfunction more severely, and there's a rich network of superficial veins in the legs.
Mm-hmm. And people are told sometimes to elevate their feet, even wearing compression socks. Does that help?
Yeah, absolutely. Elevating the feet essentially counteracts some of the effects of some valves that perhaps don't work. It certainly counteracts the effects of gravity and basically improves the efficiency of your venous system functioning.
Now,
compression stockings do a similar role by compressing the veins and increasing the speed of blood flow in the veins.
And there's good treatment for this as well, right?
Absolutely.
I remember seeing it as a child, the little needle that goes in, grabbing that vein, and it just all of a sudden it's really fascinating to see, I have to be honest. Is that what you do?
Yeah, we do that, and nowadays there are a whole host of treatments available for varicose veins, all of which are very good and very simple, and many are office-based.
What about for the more severe cases? Because there can be some that are more severe.
Absolutely.
A little bit more difficult to treat.
Yeah, it all depends on what I see when I evaluate a patient. If I see a patient who has, for example, painful varicose veins or leg swelling, perhaps they tell me that, hey doc, my legs are just really tired and swollen at the end of the day and I really want to put them up. That instantly tells me that there's a likelihood that some more significant superficial veins may be involved, and it may be a little bit deeper than just the veins that we see out on the surface. In those situations, we get a ultrasound for evaluation, a very special type of ultrasound, not the typical vein ultrasound that maybe most patients are familiar with, where we try to rule out deep vein clotting. This ultrasound involves a couple of maneuvers that really looks at functioning of the vein valves, and we call it a reflux ultrasound particularly. So that tells the treating physician where the problems are in the venous system and what veins can be treated, because very oftentimes the veins that we see out on the skin are caused by another vein a little bit deeper down, and the ultrasound often tells us where in that evaluation or where the treatment best lies.
Can you surgically remove the vein in a procedure?
We do sometimes, but really nowadays only for superficial veins. Most of the causative veins in varicose veins are treated with a whole host of newer, more minimally invasive procedures that are actually, some of which can be virtually painless and are all generally done in an office setting. One of the important terms, I guess, in the treatment of venous disease is the saphenous veins. The saphenous veins are two major superficial veins. One is called the great saphenous vein that runs in the inside middle of the thigh, and the other is the short saphenous vein that runs in the middle of the back of the calf. Those veins are the most commonly involved with vein reflux or incompetent or non-functioning valves. So many of our treatments are geared towards those bigger veins, which then improve the smaller outer veins just on the basis of treating that larger vein. Those treatments often can be done with just one or a couple of needle sticks and involve procedures that basically seal that vein closed. We have procedures that use heat to seal the vein closed and various chemicals that seal the vein closed as well.
All right, so that was varicose veins. Coming up next, we're going to get into other types of venous diseases that can pose a greater risk for our health. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for the doctor, please call us using the toll-free number. It is 855-796-4475. You can also visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel. It's live. Submit questions for the experts and watch videos from previous episodes. We'll be right back.
Hi, I'm Janelle Hale, founder and CEO of the National Breast Cancer Foundation. No one should face breast cancer alone. When I was diagnosed 36 years ago, there was no internet, and I had to make a decision with little information. Early detection saved my life. It could save yours too. To learn what every woman needs to know about breast cancer, visit nbcf.org/hope.
Every year, millions of Americans are exposed to a contagious virus.
What is this virus? It's stigma.
Stigma promotes an environment of shame,
fear, and silence.
Which prevents millions of people from seeking help.
But there's good news.
The National Alliance on Mental Illness believes stigma towards mental illness is 100% curable.
So do yourself and everyone a favor.
Go to curestigma.org and get tested for stigma.
Cancer. We don't want to think about it, but I had to. Because you see, I was traveling, I was enjoying life, I was working. It was too long since my last PAP. When I was finally tested, we thought I might have cervical cancer. After worrying, no cancer. I was lucky. Women, please get a Pap test to check for cervical cancer and get the inside knowledge about gynecologic cancers for you and the people who care about you.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverdi, and with me is Dr. Chaminda Jayanetti, and he is a vascular surgeon at Miami Cardiac and Vascular Institute, as well as at Miami Vascular Surgery. If you have a question for the expert, please give us a call. Here's the toll-free number, 855-796-4475. We would love to hear from you. So when it comes to blood clots, almost anyone can be at risk, to be honest. Let's listen from a few patients regarding their blood clots.
I first began having some leg symptoms, mostly pain in my calf. It felt just like a muscle cramp, and I really thought I had just pulled a muscle. And then I began having chest symptoms. I began having shortness of breath, difficulty breathing, pain in my chest. I had a DVT and a pulmonary embolism when I was 34 years old. Through those tests, they discovered I had a genetic predisposition to clotting.
After my husband and I got married, I became pregnant, and I delivered our son with a cesarean section. I then was released from the hospital, and I was home for about a week. And I woke up one morning and could not walk. Literally, my left leg was swollen. It was like a tree trunk. Excruciating pain, a burning sensation, redness, and a numbness in the foot. And then I remember my physician telling me, you have deep vein thrombosis, a clot in the femoral vein, and it was a very large clot, and the total vein was blocked. And that's why the leg was swelling.
I discovered that I had inflammatory breast cancer on June 30th, 2009. Part of the hospital literature that was given to me when I was diagnosed mentioned that sometimes people who have cancer and or are on chemotherapy can develop clotting disorders. For instance, deep vein thrombosis, or DVT, in the leg. And they described what it felt like. Well, just coincidentally, the last several days, I had been feeling like I had a low-grade Charlie horse in my leg. It just ached and cramped, and it just wouldn't quite let go. And indeed, I did have a blood clot, and we immediately began to manage it with an anticoagulant.
And with DVT, you may or may not have symptoms, right, doctor?
Absolutely. You know, many times that determination occurs based on the type of patient we're talking about. Many times in a hospitalized patient, that patient has a lot of things going on. They're experiencing pain, perhaps from a recent surgery that they have. Their consciousness level may not be the same as it is in regular day life. And in those patients, DVTs really can be silent entities, and it takes a very observant clinician or treating nurse or clinician to really find that problem. In patients who are in daily life, DVTs tend to be a bit more symptomatic. Generally, the most common symptom is leg swelling, perhaps some leg pain.
All right, and we're going to continue the conversation, but right now we have a couple of callers who have called into the Health Channel. Let's take our first caller, who is Oatmeal. He has a question regarding, I believe, his vein. Oatmeal?
Yes, ma'am.
Oh, thank you so much for calling in. How can we help you, darling?
Yes, I'm just having a little question about right leg varicose vein disorder.
And what's your question regarding it?
I have it wrapped around my calf muscle, my muscle, calf muscle on my bottom right leg, and it's very swole. And basically, once I get to work, walk around more than 4 or 5 hours, it swells up to a point, that you can't walk anymore. It hurts. You're down to the Tylenol, and Bengay. You know what I mean? It's pretty bad. It's getting bad. It's something I've been dealing with through medicines and Bengay and stuff like that for the last 5 or 6 years, but it just keeps swelling.
O'Neill, how long have you had those symptoms for?
I've had them now. For about 5 or 6 years.
Okay. It's not something you necessarily experienced when you were much younger than you are?
Yes, actually, I had it on my left leg. When I was in my 20s.
Okay. Yeah, I mean, O'Neill,
And
it sounds...
I had it surgically removed already.
Okay.
On my left leg, they did a very good job. And 20 years later, I get the curse on my right leg.
I see. So yeah, O'Neill, it certainly sounds like the symptoms you're experiencing in your right leg are on the more severe spectrum or severe side of the symptoms that people experience with varicose veins. Certainly, if you're having pain and swelling to the point where it's getting in the way of your regular everyday activities, that certainly could be caused by vein reflux disease. And I think with what you have, it really would be helpful, especially since you've had a good result with treatment of it in the past, to see a specialist about it. I think they could really help you. The treatments probably have improved too since when you had it treated last, and are probably much easier now.
Good point. All right, O'Neill, thank you so much for calling in. We want to now turn things to Vivian, who's calling in as well. Vivian?
Yes, I have varicose veins and restless leg syndrome. Presently, I'm being treated with a pneumatic pump on my legs. And am I doing the right thing? I'm also feeling, sometimes like in the morning, I'm feeling pain in my shin bone down my legs. So that's something new.
I understand. Yeah, sounds like you've probably seen a vascular specialist.
No, I didn't. I did see one. All he wanted to do was take my veins out.
I got you. Your symptoms, I mean, certainly could be from vein issues. It's complicated a little bit because you have restless leg syndrome.
Yes.
Varicose vein issues can sometimes make restless leg symptoms seem worse because varicose vein symptoms will also probably make you want to move your legs a bit more. When you have the chance, especially at nighttime. A lot of the ill effects, so to say, of varicose veins are experienced at night, the aching of the legs, things like that. And movement of the legs is an action that gets the muscles of the leg working and help the vein blood to get out of your leg better. So sometimes those symptoms can mimic each other, make each other worse.
Yes, I was losing a lot of sleep through cramps. Lots.
Right. The treatment for you sounds like, you're using a pneumatic pump, which is a form of treatment for severe vein insufficiency. That certainly can be helpful. Other non-procedural treatments certainly could be using compression stockings on the legs and elevation, as we'd mentioned before. Treatment of your veins, is a decision certainly between you and your treating physician. It can be helpful, but not, there are cases where some of these more conservative measures are better.
Vivian, thank you so much for calling into the Health Channel. We really appreciate your time. Doctor, before I take a break, I actually wanted to take a 3D image of a blood clot and show our viewers exactly what's happening here and how it forms.
Sure.
So let's take that real quick. And when it comes to blood clots, they can be dangerous.
Mm-hmm. Absolutely.
And they have to be tended to immediately.
Yes.
So this is it right here. Tell us what we're looking at.
So basically what we're seeing here is the inside of a blood vessel and some of the cells that comprise our blood. The red disc-shaped structures are red blood cells. There are some blue structures that are an entity in blood called platelets. These are cells that help our blood to clot. We see some yellow strands there at the formation of a clot, which represent some of the proteins or chemicals that are in our blood that also help our blood to function. So what happens in a clot? A clot is essentially like a chemical reaction that occurs within the elements of our blood, the red cells, the platelets, the proteins. They can form very rapidly as anyone who's familiar with a chemical reaction knows that the reactions can be instant. And essentially what happens is blood, which is typically meant to be liquid, turns solid. And that's the essence of the reaction. And there's a multitude of steps that occur to make that happen. But the red cells, the platelets, and the proteins get together to form a clot.
And we often hear there's an issue with the plumbing, which
Right.
I've heard a lot. So how bad of a plumbing issue was that one?
That was a pretty bad
That's
one.
a bad one.
It was a bad blockage.
It's
so.
a bad blockage.
Absolutely.
And are there ways to prevent these blood clots, doctor?
Yeah, prevention of blood clots, it all depends on what factors in an individual patient are leading to the blood clot to begin with.
Mm-hmm.
There is a triad of typical requirements to form a blood clot. One is an abnormality on the inside lining of the blood vessel. That can be from injury, it can be from recent surgery in the area. The other entity is blood that's not flowing well. Sometimes that happens with valves in the veins that are not working, or perhaps a patient who's spending a long time seated in one position in a long flight, for example. And then some inherent clotting tendency in the blood, which can come from various things. It can be either be a genetic factor, it can be a situation that arises in people who have malignancies. You don't necessarily have to have one of these, but generally one of these three things is present in anyone who forms a blood clot.
All right, we're going to take a quick break, but coming up, we're going to talk more about, blood clots and the fact that really anyone can be at risk for a blood clot. What is your risk for a DVT? Stay tuned. We're going to find out important risk factors that you should know about and you should be aware of. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question for the doctor, please call us using the toll-free number, 855-796-4475. We are here for you. And don't forget to visit our website, allhealthtv.com. We'll be right back.
Everyone deserves a decent place to live.
Everyone.
When a future homeowner partners with Habitat for Humanity to build or improve a home, they build a better future for themselves and their families.
For my family.
For my family.
For my family.
With a little help, we all have the potential to stand on our own.
Potential.
Potential.
Visit Habitat.org to provide help to families like these today.
C stands for courage, collaboration, compassion, and sometimes even cuddly. At Miami Cancer Institute, C also stands for Cure, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
It is the most amazing gift that you can give someone. Seeing individuals have an opportunity in their lives that they would never have again.
Us. It's what this country is made of. But right now, our bond is framed. How do we get back to us? The Y fills the gaps and bridges our divides. Support your local Y today. Because where there's a Y, there's an us.
We all play a role in keeping our community safe.
Every day, we move in and out of each other's busy lives.
It's easy to take for granted all the little moments that make up our everyday.
Some are good, others not so much.
But that's life.
It's when something doesn't seem quite right that it's time to pay attention.
Because only you know what's not supposed to be in your everyday.
So protect your everyday.
If you see something suspicious, say something to local authorities.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with me is Dr. Chaminda Jayanetti, a vascular surgeon at Miami Cardiac and Vascular Institute, as well as Miami Vascular Surgery. If you have a question for the doctor, give us a call. The toll-free number, 855-796-4475. You know, from sitting still to many medications, there are a number of factors that can increase your risk for deep vein thrombosis, or you may know it as a DVT. So pinning down an exact cause, it can be challenging. Understanding your risk doesn't have to be. Let's watch.
Surgeon General in 2008 issued a call to action to prevent deep vein thrombosis and pulmonary embolism in patients, particularly hospitalized patients, to use the appropriate measures to try to do that. And the role of the CDC is to help make people aware of this as a public health issue, and also to have a better understanding of how common it is in our society.
People at risk for DVT or PE include absolutely everyone. It's hard to say that anything or one factor causes deep vein thrombosis and pulmonary embolism, but there are many things that increase the risk, and a number of things can work together to greatly increase the risk.
There are three things that are really important for patients to know to prevent DVT. Number one is to know the risk factors of DVT-PE, to know that recent hospital stay, immobility, surgery, birth control pills are risk factors. Knowing, do I have a family history of blood clots? Number two is to know the symptoms of DVT-PE. So if they do occur, the person is aware this could be a DVT and PE and be checked out for it. And then thirdly, since the majority of DVT-PEs happen in the hospital, I think it's important that patients be proactive and ask their physician, should I get DVT prophylaxis? Am I at risk for DVT or PE?
All right, so the doctor is next to our 3D image wall, and this is an example of a DVT. I have a lot of questions regarding it. A lot of people have heard of it. First of all, what causes it, doctor?
Numerous things cause DVT. One of the most common causes of DVT is in a hospitalized patient who is immobile, laying in bed in the hospital. Nowadays, we've taken a lot of precautions to try and prevent that entity, but it still occurs and is still something we think about in the surgical world all the time.
Where do they normally occur, doctor? In what part of the body?
DVTs are often born in the small calf veins down in the lower leg. That's an important part of the pump that propels blood back to the heart. DVTs can occur really anywhere in the legs as well. Sometimes they occur in a vein called the femoral vein, which is in the groin, and sometimes even in veins higher up in the system called the iliac veins. Those can be very dangerous.
So looking at that image that's right next to you, can you explain to me what's happening when a DVT occurs?
Yeah, here essentially you see the blood clot here, and this is a nice representation of what goes into forming the blood clot, which is red blood cells, platelets, which are these blue cells. These are the clotting specialists, so to say, of the blood. And then, of course, as we'd mentioned before, these strands of yellow tissue are the proteins or chemicals in the blood that alter form during formation of a DVT to form to take liquid blood and make it solid, which is essentially what happens.
I'm sorry, doctor. And how does it affect the rest of your body?
Well, DVTs certainly have a local effect in the vein in that instantly an obstruction is created to blood flow. That can, of course, cause swelling below that area. The leg can often become swollen and red, painful perhaps. And the main effect that DVTs can have elsewhere in the body is that they can break loose and cause a much more serious entity called the pulmonary embolism. That's when this blood clot goes up and through the heart and lodges somewhere in the lungs, and the effects of that can range from anything or something minor to something potentially fatal.
And doctor, I was reading here that the CDC says that 1/2 of people with DVT will have long-term complications. What type of complications are we talking about?
The most common complication that occurs after DVT is essentially persistent swelling of the leg. What happens when you have a clot in this area is that this inner lining of the vein, called the intima, often sustains some damage. If there were some vein valves in this area, they would be potentially damaged as well, and that would essentially lead to poor function of those valves and potentially leg swelling, leg pain. So those are the main long-term complications of DVT.
All right, I have a couple more questions, but I have a viewer on the phone who's calling in. Her name is Sandra from Lake Worth. Sandra, are you there?
Yes.
Oh, thank you so much for calling into the Health Channel. How can we help you, sweetheart?
Yes, I have a question. My mother is 79 years old. She is obese and she has hypertension, and I want to know if the compression pantyhoses or the stockings are good for this kind of person.
Great question, doctor. Your suggestions?
Yeah, certainly. If she has leg swelling, compression therapy can help in the legs. Some of the barriers in a patient who has obesity certainly can be ease of use for the stockings, and there are various devices that can either help a patient use a stocking or different types of stockings that may be easier to use, but certainly it can help.
All right, Sandra, thank you so much for calling in and asking that question. A great question at that. A lot of people can relate to that as well. The CDC also says a lot of these blood clots could be prevented with proper awareness. That's why we do the Health Channel, to make you more aware of situations. Let's take a look at this.
I'm currently on anticoagulation medication and will need to take that for the rest of my life. But I've been very lucky. I've not had any additional symptoms, no more blood clots, no pain related to the blood clots. Once that episode resolved, I've had no problems at all.
I live with this problem every day of my life, and it has now been over 30 years. It impacts every decision you make daily.
I was lucky because I found it when it was still pretty small and was able to get appropriate medical attention right away for it. So the biggest effect that it had on my life was the fact that I had to take the anticoagulants.
I think a lot of blood clots could be prevented if people knew their risk factors and received appropriate DVT prophylaxis. So I think there needs to be a body that increases the awareness about DVT and PE and the symptoms in the general public.
I think the most important thing people can know is that everyone is at risk for developing a blood clot. And especially if you've already had a blood clot, you are at greater risk for having a future clotting episode. So it's important to know the symptoms of blood clots. It's important that if you start having some of those symptoms, to seek help right away and not delay in getting care, because delay can be deadly.
Be your own advocate. I don't think that it's wrong to challenge or question physicians today or caregivers today, because the more informed you are, then the better chance you are to take yourself out of a position where you could potentially get a DVT PE.
So, doctor, what would you say is important for people to keep in mind who aren't aware of their risk for DVT?
Absolutely. I think the main thing is not to ignore any symptoms that you may have. As we heard on some of those segments, things that started out as a simple feeling of maybe a persistent cramp or pain in the leg, maybe some swelling that's persisting. Those are things that you really shouldn't ignore. You should seek advice from either your primary physician, or if you know a specialist, certainly go to see them. But mainly, I think the biggest message I can tell patients is not to ignore your symptoms. Know that there are serious things that can mimic what may seem like a very simple thing.
Right, and we can't ignore the fact that there are children around the hospital doing trick-or-treating today.
That's right.
They have all the right to be screaming and being happy because it's candy, it's candy, candy. So that's what you were hearing, and they're having a lot of fun. What about people who are at high risk? How can they be proactive about staying healthy?
Yeah, certainly high risk. We mentioned a couple of those risk factors. Certainly obesity, sedentary lifestyles, potentially people who have a known tendency to clot in the blood. Being proactive certainly, I think, means looking out for those situations that come about in life that put you at higher risk for DVT. I tell all my DVT patients to let us know before they go on a big trip, so that we can maybe advise them on a couple of things to do before going on that trip. Make sure your compression stockings fit you well. Potentially, some changes in medication. Certainly, staying hydrated, which can be a problem for travelers, on airplanes.
That's good advice. Good advice there. We have another caller calling into the Health Channel. Her name is Debbie from Miami. Debbie.
Yes, I'm here. Hi.
Hi, thanks for calling in. How can we help you?
I'm interested in the subject that you're talking about, but I'm wondering if it has anything to do with ankle swelling and foot swelling. Do those areas apply to this discussion?
Yeah, Debbie, thanks for calling. Certainly, ankle swelling and foot swelling can be part of the symptoms of venous insufficiency or problems with the valves of the veins working properly. Foot swelling particularly can also potentially indicate another entity called lymphedema. Lymphedema is a dysfunction in lymphatic vessels. That's a third lesser well-known type of blood vessel. And certainly you could have lymphedema, and evaluation by specialists would sort of help determine which of those two different processes it may be.
All right, Debbie, thank you so much for calling in. Great questions from our viewers today.
Definitely.
Fantastic. All right, we're going to take a quick break for our last segment. Coming up, we're going to go over other issues that can happen to your veins and what you can do to prevent them. Remember, you're watching the Health Channel. All health, all the time on South Florida PBS. If you have a question for the doctor, call us using the toll-free number right there, 855-796-4475. You can also visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel, submit questions for the experts, and watch videos from previous episodes. We'll be right back.
Thanks, Coach. Thanks for teaching me about teamwork and leadership.
Thanks for showing me that sports help me stay healthy and do well in school. And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion, and how to protect my head and brain, because one day I want to be a teacher, an astronaut, scientist,
or a coach, just like you. Thank you for protecting my future.
A smile. It can show how we feel. It can change the course of our lives. But what would life be like if you weren't able to smile? It doesn't have to be this way. Since 1999, Smile Train has been helping children experience the simple joy of a smile. To learn more, call or go online now.
I am incredibly proud to be a physician here at St. Jude. To be in a place where I know my patients are going to get the top-notch care, not only care, but also research happening 24 hours a day, 7 days a week. Every single person that contributes is a part of that St. Jude family that makes that happen. Because of the research, because of all the donors, because of everyone that is really committed to the mission of St. Jude, we're giving families hope.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverdi, and with me is Dr. Chaminda Jayanetti, a vascular surgeon at Miami Cardiac and Vascular Institute, as well as at Miami Vascular Surgery. If you have a health question for the doctor, give us a call. The toll-free number is 855-796-4475. So we are quickly wrapping up this hour on venous disease, talking about how our veins can become damaged. Doctor, something that can happen to our veins is superficial thrombosis. I've heard of that just a little bit, or inflammation.
Right.
How does that happen?
Superficial thrombophlebitis is one of the things that can occur when we have valves in our veins that don't work and basically develop varicose veins. Blood, as we had mentioned before, in varicose veins doesn't flow well. It sits still, and that's really one of the factors that can promote clotting of blood in the vein. That term phlebitis implies inflammation, swelling, pain. So oftentimes these superficial clots can be very painful. They can be very different entities than deep vein clots. They're not as dangerous. They can spread into deep veins and potentially lead to DVT. But oftentimes what patients will notice would be a small, very painful area of hardened veins. And certainly if you see that, that's something that you need to alert your doctor to.
Is it a constant pain?
Yes, definitely. It's constant.
It's always there and you know something's wrong.
Very sharp, always there, and definitely very dramatic, can be.
Who is at risk for this?
Basically, anyone who has varicose veins can be at risk for it, or anyone who has some condition that predisposes them to clotting. That could be certain genetic disorders, women who are in pregnancy, people who are on hormone supplementation, even something as simple as cigarette smoking can give you an increased risk for clotting, and typically it's those patients who might get superficial vein clotting.
I'm glad you brought up the smoking, because we were just talking about it when we were in a commercial, and I asked him, I said, does smoking affect all of these venous diseases as well?
Yeah, it can, in terms of its ability to increase your clotting tendency. So from that perspective, yeah, even smoking can even affect veins. We're most familiar in our world, of course, with the effects of smoking on arteries and causing blockages of arteries, heart attacks. But certainly it has an effect on veins as well.
Has an effect on everything in the body.
That's right.
More reasons to just not do it. The superficial thrombosis, is this something that a person could see and feel?
Yes, typically it's superficial.
What are we looking for?
Basically, in our world, we have a term called a cord. A cord is just a tube-like...
A cord like C-O-R-D?
C-O-R-D, a hard tube-like structure that a patient can feel beneath their skin. So usually it's very evident, and sometimes they're not always. There are cases where it's not as painful as others, and we might see a patient who basically comes in saying that, listen, doc, I have this lump, this long lump I feel in my hand, or oftentimes people get them after an IV. So a person may go to the emergency room with a complaint, get an IV, and after that IV is taken out, they may come back to us with this hard mass that they're feeling. It ends up being a superficial phlebitis.
But like you said, it's not that serious.
Not that serious. Typically, that entity is treated just with what we call cold compresses and some anti-inflammatory drugs, NSAIDs or aspirin sometimes.
How do you diagnose the condition?
Oftentimes, that's a clinical diagnosis. We often will confirm it with a vein ultrasound, though.
All right, so far we've covered varicose vein, deep vein thrombosis, superficial thrombosis. Are there other conditions, doctor, that are related to venous diseases that we haven't covered?
Yeah, I think the important thing to talk about is, again, the risk factors for venous disease. It's really amazing in that it's a disease process that occurs in so many different age groups and in so many different people in so many different conditions of health. We see it in people who have obesity or who are elderly. We also see it in people who are as young as their teenage years. We see it in people who are very healthy, people who are professional athletes. Sometimes the causes of all these or causes of varicose veins and venous disease in these different people are very different, but it can affect all of them.
Exactly. We are joined once again by Sandra from Lake Worth. She has another question for you.
Great.
Sandra, take it away.
Yes, hi, doctor. I wanted to ask you, I know you said smoking is not good for the veins. I was just wondering, I don't smoke, but I was wondering if you smoke marijuana, would that also affect the veins?
Marijuana, certainly has a different set of chemical compositions than tobacco smoke. So potentially, it would have some chemicals in common, and the risk I would say is not as great as with typical cigarette smoking.
Okay. Answers my question. Another question: the compression hoses, if they're not sold in CVS for obese people, where can my mom get the varicose veins, the compression hoses for her? Where can she go to buy them?
She could certainly see either her primary care physician, who may be comfortable prescribing compression stockings, or if not, she could see a specialist who treats venous conditions. The specialist may have more options available in terms of types of stockings, stockings that may be easier to fit on patients who have obesity, which I know you mentioned before. So I would recommend seeing a specialist. They can offer you a lot more options potentially with that.
So a specialist would be like a cardiologist, or what is it called?
I mean, I'm a vascular surgeon, so I'll plug vascular surgery. Certainly, that's one of the main things we do is, advise people with leg swelling, how to manage it best.
Vascular surgeon.
All right, thank you.
I think that answers my question. Thank you so much. Is there exercise good for the legs that it's actually good to bring that blood flow back to the heart?
Absolutely. The veins in the calf muscles, specifically in the leg, and even the big thigh muscles, are very, very important in pushing the blood back upward towards the heart. So exercise can get that done. And there are some cases of vein disease that get a little worse with exercise, but again, generally exercise is always a good thing, and I never discourage patients from doing it.
All right, thank you so much, Sandra, for calling in. Hopefully she got all her questions answered, which is fantastic. Good questions as well. You brought up the specialist, which I'm glad you did, and you obviously spoke to Sandra about going to see her PCP, or her mom to go see the PCP. When should someone go see that specialist to start getting involved? Because a lot of people go to the PCP first.
Right. I mean, thankfully many primary care physicians are very knowledgeable about venous conditions and can certainly offer the basics of treatment and know when to refer patients to that next step. Generally, in our world, we recommend coming to us when your veins, have become more symptomatic. They're bothering you every day. They make you alter the way you go about your life. They make you want to take breaks during the day to put your legs up. That's certainly someone who I think will benefit coming to see us. We also have a lot of people on the other end of the spectrum where they see some varicose veins and they just want some reassurance that it's not going to be something very serious or threatening to their life or health.
Absolutely. Speaking of health, we only got about a couple minutes left for this show. Any heart-healthy lifestyle choices that you would recommend to our viewers to prevent these kind of venous diseases?
Right. I mean, the nice thing about varicose veins and helping with venous disease is that typically things that are good for your body are good for your veins as well. Getting exercise, losing weight if you happen to be overweight. Those are all things that generally help your vein. But keep in mind, sometimes, we see plenty of people who are in excellent condition and do CrossFit every day and certainly have varicose veins because of it. And, again, it's a condition that affects so many different types of people and different people and different people in different health conditions that, the main thing is keeping those healthy habits going. And, if you're healthy already and exercising already and your veins are bothering you, come see someone. And if you're not so healthy, generally things that help your overall health help your veins as well.
Absolutely. It's been such a great hour. We've learned so much with you. It's been such a pleasure having you.
Well, thank you for having me.
This is the first time the doctor's been on the Health Channel, and you've done an amazing job.
Well, thank you.
And the calls were fantastic too, and we thank our viewers always for calling in. The doctor also has 3 beautiful children, so I was just going to ask him real quick, since we heard the children screaming trick or treat behind us. What are your kids going to be tonight?
So I have a older son, Jahan, who's 8, who's going to be he's going to be a squirrel tonight, which is not far from his personality sometimes.
Okay, we got 30 seconds.
Yeah, and Lauren, who's going to be Kylian Mbappe, for all your France fans out there, and my littlest one, Orla, is going to be a cupcake.
Oh, a cupcake! A vanilla or chocolate cupcake?
You know, I'm not sure.
Who knows? With sprinkles on top.
That's right.
It's been such a pleasure.
Great. Thanks for having me.
Thank you so much for being here, Doctor. Truly, we've really enjoyed this hour. And be sure to join us next time on the Health Channel. All Health All the Time on South Florida PBS. Follow us on Facebook and Twitter at All Health TV. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel, submit questions for the experts, and watch videos from previous episodes. I'm Olga Villaverde. I hope you have a blessed and safe, happy Halloween. Do a lot of trick-or-treating. We'll see you next time. Take care.